Any other cause? Heredomacular degenerations, they occur at younger age. Right? They occur, heredomacular degenerations usually occur at younger age. कोई और cause नहीं किसी ने बोला? Chronic glaucoma नहीं बोला? Yes or no? If you want to put chronic glaucoma, put it bottom. Because these days, with so much awareness, a patient of chronic glaucoma is usually diagnosed much before his visual loss starts presenting. He has other things like visual field defect, small scotomas, and it is diagnosed. That is why it used to be a very important cause, chronic open-angle glaucoma when we were residents, but now it has gone down. So, important causes of chronic painless diminution of vision, I repeat, senile cataract, diabetic retinopathy, age-related macular degeneration, other kinds of posterior ischemic choroiditis, and other kinds of degenerative and inflammatory diseases involving the posterior skin. Right? So when you start examining a patient with these complaints and this age, you already have that he might be having cataract. Right? He might be having cataract. And on examination, just a simple naked eye examination with torchlight will tell you in most of the cases that the pupillary reflex is altered. The pupillary reflex may be brownish or blackish, or maybe grayish, white, more white, depending upon the degree of cataract. Okay? So, as an MBBS student, we only want you to diagnose cataract. If you are suspecting that there is cataract and you are not getting the altered pupillary reflex, the next question is what you will do? You will examine with dilatation. For practical reasons, sometimes you need to differentiate between immature and mature. First feature of cataract is some disturbance of vision. Right? Clear? In immature cataract, vision can be anywhere from 6/6 on the Snellen's chart to finger count. In a mature cataract, the vision would be finger counting close to face to hand movement. So there is marked loss here, partial loss here. The vision may range from 6/6 to finger counting 1 meter, 2 meters. Right? 6/6, why I said? Because in early cataract, the vision is not affected. It is only some glare, some disturbance, something, haziness. But when you start the vision would be normal. So vision is partially affected in immature cataract. In mature cataract, it is grossly affected. Never in pure cataract is there loss of PLL. What else? Pupillary reflex. Grayish, white. Here, white. Iris shadow? Iris shadow? Present here, absent here. You all know what is iris shadow? Yes. You throw light from the side and the image, the shadow of the pupillary border falls on the lens. And naturally it will fall there if there is a distance between the iris and the opaque lens. If there is no distance, you don't see a shadow. Right? What else? What else? Or कोई difference नहीं? और कोई difference नहीं? What about red glow? Red glow will be present here, will be absent here, and if you try to examine the fundus means the posterior segment of the eye, you may be able to see some details of the optic disc and vessels and macula in immature cataract. You cannot see them in mature. Right? So that is it. That is why I am putting it in the end. Fundus details may be seen, are not seen. Why are you talking amongst yourselves? You want to ask something, ask me. You want to ask her something, wait for 5 minutes, ask her after that. Why do you want to find out, differentiate between these two? Treatment. How will the treatment be different? I would say that if it is a mature cataract, we would advise the patient not to wait. If it is a mature cataract. If it is an immature cataract, then also we will advise the patient not to wait. But we have the option, and the patient has the option, that he could wait if it is not suitable. Right? Because the current concept, the modern concept of cataract surgery is that you should operate it whenever it is disturbing the patient daily routine. Whenever it is disturbing the patient's daily routine, we operate. I'm just finishing. Just half of it, yes. And why so? Why so? Because visual rehabilitation after cataract surgery in the modern times has become very good. See, whenever you do something to anybody, as a doctor, let us say, then you should at least know that he will become better from what he is doing. So these days, the visual rehabilitation has become so good that we usually now do not wait for the cataract to become mature or hypermature. We operate as soon as it starts affecting the patient's day-to-day activity. Obviously, my day-to-day activity, a very early cataract will affect. I am a surgeon. A farmer's day-to-day activity, the cataract may advance a little, then it will get affected. So whenever it is disturbing, just operate. So we finished for today. If we get a chance, we will complete cataract, and in the meantime, that is your homework. Read about nuclear cataract that I have not talked about. Read about pupilliform cataract, and surgery, of course, the MBBS student is not going to do, but you should have an idea that what was done. Clear?